Paramedics are overwhelmed with COVID-19 calls. That is on top of the other emergencies they have to respond to every day. Tonight I spoke with MedStar's Matt Savadsky about what they are facing in Tarrant County. Here is part of our conversation.
So Matt, what is the situation right now at MedStar?
Right now, the situation is getting a little bit more concerning. Yesterday, we responded to 131 patients where the crews identified the patient likely had the coronavirus based on symptoms, history, that kind of thing. And that is up from only about 43 cases back in early October. So to now go from 43 at the beginning of October all the way back into July, we had, an average of 85 cases. We're now, here we are in December as we go into this holiday season, up to 131 cases yesterday. Very concerning.
How are your people holding up?
So the EMS workers across the region, and certainly here at MedStar and really across the country, are really beginning to feel the strain. Hospitals have high occupancy. They have some staffing issues. EMS volumes have been crazy because of everything going on with the coronavirus and other things as well. So these folks are running a lot of calls. The calls that they're responding to require PPE all the time. So they're having to continually put on PPE, take off PPE. Many of these cases are potentially high risk. So the emotional stress on a lot of the EMS workers at the tip of the spear in this coronavirus is getting very, very difficult.
We're starting to see the vaccine roll out, hopefully within a matter of days. What are you hearing about getting the vaccine to your people, Matt?
So thankfully, the CDC, ACIP, and even the state of Texas have classified emergency medical services workers in the top tier for the coronavirus vaccine. Now, we're also in that same tier with healthcare providers and folks in a skilled nursing facility. So as more of the vaccine becomes available, EMS workers are at the top of the list to get vaccinated. So we anticipate probably in the next couple of weeks, we're going to be doing that. And Brian, quite frankly, part of the reason for that is that EMS agencies here in Texas and across the country are being used by the health departments as an administration strategy. So we can actually mobilize, go out into the community to actually administer the COVID-19 vaccine. So we want to make sure our folks get vaccinated early so that they can become the vaccinators for the rest of the community.
Matt, what do you need most right now?
What we really need most right now is a recognition that this is an unprecedented time for the healthcare system. And what we really ask the community is be cautious, wear a mask, follow all those guidelines, help us not get further stressed with hospital occupancy, with EMS call volume, 911 responses. And if we do arrive at a scene of a call and we recommend to you that you not go to the hospital, because we're doing that now, because there are some cases that don't need to go to the hospital, take that advice, follow the directions of the EMS system, follow up with your doctor, with your primary care system, try and help us manage this patient flow to prevent the hospitals from becoming overcrowded.
Matt Savadsky there with MedStar. We have posted that full interview on our website, nbcdfw.com.